It was like grade 1, nag-start from the very beginning.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Ako po si Bhiem, but you can call me Bhiem for short.
Man knows best.
I have my work experience prior to going in the UK. So I was 5 years I was a community health nurse in Bacolod. And then after that, there was an opportunity to work in Saudi Arabia as a dental health nurse. So I grabbed the opportunity because that was the first time work offering for overseas. So yon, luckily I was assigned in a dental polyclinic.
All right, go ahead and rinse.
Oh, the human mouth is a disgusting place.
Our polyclinic in Saudi Arabia is mainly composed of general dentistry, oral maxillofacial, orthodontist, implantology, and surgery. Luckily, I was given the chance to work side by side with the implantology and oral maxillofacial dentist. So I'm working with 2 dentists before, but I was mainly assigned with the oral and maxillofacial surgeon, dental surgeon in Saudi Arabia. So that was from 2015 up until 2018. And that was solid 3 years experience in Saudi Arabia po. And then I went home to Bacolod. So 2018 to 2020, I processed my UK application and luckily was able to fly to UK January of 2021.
Man knows best.
Acute medical unit. So I stayed there for 3 months. And since I was still supernumerary in AMU, I still have the chance to select whatever area I would like to be if there is any opening. So there was an opening in the ER. I grabbed the chance. I talked to the ward manager and she told me that it's okay because they are just in the same line of business unit. That's what their term is. So yeah, I was transferred to ER. And I was working with ER already for like 2 months. 1 month for supernumerary and 1 month as a full-time staff nurse.
Man knows best.
To be fair po, since I applied with the agency 2018, prior to that, parang hindi sila tumatanggap ng any other experience other than a solid a solid hospital experience. But I remember it was around later part ng 2018 when the NMC announced that UK is accepting applicants without any hospital experience. Yan, parang naglabas sila ng guidelines ng NMC. So when the news came out, I looked right away for agencies who will be accepting my background as a dental health nurse or a dental nurse in Saudi Arabia. Well, there were some agencies that refused because they were saying they were not looking for it, so hindi daw pasok sa kanila. So naghanap lang po ako sir, like around 3 agencies, 4 agencies, and luckily there was this agency who is accepting any experiences kahit na walang experience, so long as you're an IELTS passer and a CBT passer, which is I was an IELTS passer and a CBT passer prior to looking for the agency. They're really looking for a solid hospital experience. And I'm like 32 years old na. So, babalik pa ba ako? Nag-Saudi na ako. Babalik ako sa dental. tapos mag-hospital. Pero yung mga doubts that time. But tiyagaan lang po talaga. May may nag-open ng slot. They are willing to take me. They open for the interview, the agency in the UK. So parang ano nga tawag nila, parang yung partner agency nila sa UK. They facilitated the interview and there was this agency person in the UK who made the interview with in the Philippines via Zoom. And yun, interview, nakapasok naman ko, awa naman.
Manong knows best.
To be fair po, the transition, personally, I'm just speaking on my own experience. It was really hard, considering that it has been like 10 years since I graduated nursing, and then wala na, parang hindi ko na masyadong matandaan yung mga skills kasi it's really different. So when it comes to OSCE preparation, I am just very lucky that our trust is one of those trusts that are very supportive when it comes to OSCE preparation. So parang talagang nagsimula kami from parang pinaka-start, parang grade 1 when we arrive here and we start for our OSCE. So ayun, every 3 times in a week, meron kaming OSCE review, which is half day. And then it's straightforward, wala nang paligoy-ligoy, lahat ng stations. And then every after the OSCE preparation, there's parang debriefing, what went wrong, what could have been approved, ano pa yung dapat gawin, saan i-improve. So yun naman po. And maraming mga handouts na binibigay, maraming mga videos na binibigay. So yun yung mga parang naging point review materials po ng group namin.
Manong knows best.
To be honest po, pagdating sa trabaho, talagang parang zero. Talagang start from the scratch talaga. Kasi the UK setting is very different from the Philippine setting. More so that I was in the dental field in the Middle East, which is a very different thing. So it was like grade 1, nag-start from the very beginning. Like, yung processes nila, yung mga programs na ginagamit nila sa computer, at kung ano yung routine nila when it comes to how you open your shift, in the middle of the shift, and in the end of the shift, parang ganun. More so na ER, from AMU, naka-adjust ako for quite some time, 3 months, and then I transitioned to ER, which is a very different, there's a different dynamics going on in the ER. So ayun, another adjustment. But so far, surviving and thriving naman po. It was very hard from the very beginning. Again, as I was saying earlier, considering I have a different background, but alam mo naman po, basta Pinoy, go lang ng go, yes lang ng yes. We're very resilient. So, okay, matutunan din natin in your own pace, in your own time. But of course, you do double time. You learn fast you have to learn fast. And just being resilient anywhere, regardless of the area that you will be assigned to.
Manong knows best.
For aspiring to become a UKRN, regardless of their background, maybe in dental, community, or ano man yan, clinical, don't lose hope, don't give up, and it really pays to be resilient. Hanap lang ng agency, hanap lang ng job opportunities that a certain trust or a certain hospital offers. Again, being a UKRN is not just focuses more on the hospital setting. So marami ako mga friends na they are in a nursing home, they are in the community, they are district nurses. So, but their background is they are in the OR, they are in the ward. So, ano lang po talaga, wag lang talaga sumuko. Maghanap lang po talaga ng agency na willing and happy to accept your work background so long as you are an IELTS and activity passer. Yun yung pinaka-importante.
Always remember, Manong knows.
Yeah. Came in 17. Damn.
Manong knows best, put your worries to rest when staying in the United Kingdom. Manong knows best.